quickly I'll go into the list. Okay, we have 2 dental chairs. We have 1 room which has those student chairs, but we're planning to expand. We have 2 chairs, side assistants, and 1 dental hygienist who is in training. And we have 1 dental X-ray unit. We have just received the panographic X-ray from Global Health Ministries, actually 2 of them, and those will serve several other clinics in town, because those are the only ones in Arusha and Kilimanjaro. The next one is 250 kilometers away.
Oh, a good distance.
Sorry?
A good distance away.
Yeah, a good
for a
distance
patient to travel.
in another country, so you'll need a passport to go.
Oh, that's a good point.
In a month, we see around 180 patients. This is the new book we had, but today is 20th, and it's 21st, and the first patient will be 118 patients. So we usually range around 120, 130 patients a month.
Mm-hmm.
Yeah.
That is good.
But most of these patients, because we don't have, most of the patients come in for emergencies, so you end up doing a lot of extractions, some root canal treatment. This is because patients cannot afford, cannot pay, and sometimes they come in with grossly carious teeth.
Yeah.
Which even if you do a root canal, then you need to have pins, and then a crown, and then a build up, and then a crown on top, which they cannot afford, and the patients are not here. We'll send in a report of our last 2 years report on Sunday.
Okay.
And our plan for what we want to do with periodontal treatment, and we'll keep on sharing this as we expand, because we want to have a complete, some sort of a business plan for the oral radiology unit, which we call the oral radiology unit, which will do the x-rays, because we have some clinics in town which don't even have the dental x-ray, and they send their patients here for just the dental x-ray. And we expect to use the panographic x-ray especially for trauma cases, where fractures of the jaws can be clearly seen. Like at the moment, we had a very bad accident in Mandi, and we have a patient in ICU with a fracture of the mandible, a mental process in the body of the mandible. It's difficult to really see, and actually the part of the mandible which is fractured is dislodged and transposed posteriorly. It's a little bit difficult to see with the skull x-rays they have there. We don't have a dental poor fund at the moment, but then we are charging very low, especially for children who are coming from orphanages around here. And those are coming. There's also a school it's called SOS school, close to Australian, and they bring their children here, and we charge them very low. Our most important needs for the dental laboratory when we expand, and also for materials. We get our supplies from Nairobi and from Dar es Salaam, and these are mostly middlemen, so we pay close to 40 or 50% more of what we would pay if we get them directly from suppliers. We'll send an email and give our needs and our plans, so that when the Global Health Ministry Dental Committee speaks, and they know, and even when you receive donations, you know whether they fit in with our plan or not.
Sure.
But we are also thinking of some sort of a centralized system, whereby clinic here or clinic in Dodoma we could have a simple centralized ordering system, so that we work with the economics of scale, so that if we need we agree which type of materials we need, so that we don't order same thing but 2 different brand names, which also makes work difficult.
So same item in larger quantities, so you can realize more cost savings.
Yeah, more cost savings. We would like to. We could have a volunteer who would come in and also look at our work and even advise. And like we had Jim Herrick, who came to Dodoma to train the dentists in Dodoma and here on rotary endodontics. We went there, but then we haven't been able to buy the equipment for rotary endodontics, so we haven't started that yet. But it's in plan, because we'll make it will make some income to the clinic. If we do that, we'll have less X-rays than the one we are taking now, and the treatment will be more predictable and more faster. We have an arrangement where volunteers come through the hospital, and there are some houses owned by the diocese, and I don't see a problem. The housing will be there, but then we'll have to ask about the eating, because I know even for those volunteers they have to contribute some money for their stay. So we will work out the numbers and then hand them to you.
I stay at Wangaza, which is not too far, and they charge $25 per day, and that includes breakfast. And then for lunch and dinner, they can find local, or so I would think not too much.
Yeah, not too much. There's also a cafeteria here at the main hospital where we also go there.
How much do they charge there?
Lunch is 2,500 to 3,000, which is probably $1.5 to $2.
Yeah, it's not much at all.
Yeah, it's not much at all. Yeah.
And dinner is the same or a little bit more?
Dinner is around the same.
Same.
Yeah.
So very reasonable.
Yeah. And in those houses, I think they have cooking facilities, so they could buy. And most of the time, there's some volunteers even on the medical side. So you could imagine you could share the house, but then have different rooms, and you could have a common arrangement where you have your supplies in. Yeah.
Very good.
Yeah. We'll on Sunday we'll also go through the question because we want to add some more, and then we send this by email.
Very good.
Yeah.
Do you want to show the X-ray room?
Yeah. Let's show you the X-ray on this side. That's the cashier's place and the nursing station.
Habari.
This was the X-ray room which was used by the clinic, and we are planning to put the fan here so that we could, because it's already protected, we're not going to have any changes. So most of our X-rays will be taken here, and the dark room is on this side. There, that's where we have dark room. Yeah.
Very good, thank you.
There will be some reconversion. Some of the rooms will be changed so that you could have space for the dental laboratory, and even for the dental laboratory also we're going to have some of the process made for clinics which are around Arusha, and it will be, we expect it to make some money for the clinic so that to cover our running costs, and then at that point we are thinking of looking at ways in which you could have especially children come in. Maybe we could go to schools and then have them come in for simple restorations, which will be done either free of charge or at a lower cost. Sometimes we get problems when we provide services for free and people take them for granted, but then we can have them at a very low cost so that people also value the service.
And invest in their health.
Yeah, and invest in their health.
Very good. Thank you. Asante sana.
Thank you. Asante sana.
So, on behalf of the Global Health Ministry's Dental Committee, we say thank you for what you are doing.
Thank you very much. We also thank you very much for the help we get from you, and I hope this talk will show that you're doing a very good job and you're changing people's lives.
Asante sana.
Asante sana.
Bwana asifiwe.